This year, we've heard a lot about childhood diseases like measles, mumps, pertussis, and more making a comeback. CDC officials directly link that comeback to the prevalence of unvaccinated people and beliefs and misconceptions about vaccinations.
Well, right now, the U.S. is dealing with the worst measles outbreak in decades. Measles was declared eliminated in 2000. In 2008, the CDC shows the first instance of annual infection increase blamed solely on communities with groups of unvaccinated people.
Jump to 2019, this year's total so far sits at 704 infections. That's just in the first 4 months. It's the highest number in 25 years. A quarter century statistics aren't much better for mumps, with 736 infections so far this year. Healthcare officials started seeing a rise in outbreaks in 2006.
Well, then pertussis or whooping cough. Just yesterday, 3 cases were reported at Bryant Middle School. And though it can be deadly, many pertussis cases are not diagnosed and therefore not reported. And still, the CDC has tracked an increase in cases since 2005. In Arkansas specifically, 69 cases of whooping cough were reported in 2018. In 2017, Arkansas reported 225 cases, and one of them, 2-week-old Katelyn Flowers.
TV 11's Jordan Howington tells us her mom has a warning for parents after Katelyn nearly died from the disease.
Yeah, luckily, Katelyn did survive, but not without further complications. And now with the most recent outbreak in Bryant, Whitney, Katelyn's mom, hopes her story inspires others to get vaccinated.
She was 2 weeks old and she coded.
In 2017, Whitney Flowers' worst nightmare became reality.
We found her and she was laying in the floor playing. Found her, she was blue.
Her 2-week-old daughter, Katelyn, rushed to the ER.
Of course, they just started running all different types of tests.
Doctors diagnosed Katelyn with whooping cough, a highly contagious disease targeting the respiratory tract.
In the first couple of weeks, it just causes what you think is just a cold.
Then evolving into a continuous coughing fit that can last weeks.
It can cause real problems, and the people we worry most about are very young children.
Especially children under the age of 1. Dr. Gary Wheeler with the Arkansas Department of Health says there's a high mortality rate in children who develop whooping cough.
And they're either found dead at home or they die of complications of their respiratory disease.
Luckily, Whitney's daughter survived, but not without complications. Katelyn's now 2 and has hearing loss from the illness. Whitney says her daughter picked it up from someone not vaccinated. After hearing of the current outbreak of whooping cough at Bryant schools, she hopes her story inspires others to get the vaccination.
It was hard to watch, and I don't want another parent to go through that.
Doctors say children should be vaccinated and adults should too,
even if they've had it as a child.
Whitney hopes parents who are non-vaxxers can overcome their fears.
If you're scared, that's what a vaccine causes. I would much rather my child have a so-called disability than no child at all.
The doctors highly recommend pregnant women and the father to get the vaccine also. That's because they say it'll help protect their newborn long enough until they are old enough to receive their first shot.